ICU is now strategically planning for expansion when we need to.
Alberta hospitals bracing for impact as variant cases double in the past week. More beds have filled up in recent days as a result, with doctors pondering some variant mysteries.
Because we don't have the science about whether these variants can reinfect people who've had previous infections, we may not be able to cohort or put people together in the same rooms who have coronavirus.
Reproduction number, which is something that we talk about fairly frequently, is higher. So it has faster spread.
In fact, variant frequency is growing across Canada. Ontario, BC, and Quebec all reporting record numbers. And while vaccinations for older and at-risk Canadians have helped mitigate spread in those communities, the variants have merely focused their attention elsewhere.
Right now, the highest rates or highest incidence is in the younger age groups.
We have seen, unfortunately, a small increase in fatalities with regards to variants.
Early data shows variants have a higher rate of severe outcomes, both in terms of deaths and lingering conditions. Complicating things further, fears a variant could soon be the dominant strain in Canada.
This is probably, inevitable, and we've seen that in pretty much every jurisdiction. This strain has established community-level spread.
What we've seen overseas has actually been exponential. It's really, really rapidly risen.
So far, Canada has been spared the severity of the variants seen in countries like the UK, but experts say that's just one more reason to not be complacent about restrictions.
Other countries are sort of a long way into it, whereas we're at the start of this, what they're calling the third wave, and the third wave is really being driven by the variants.
And to beat an exponential curve, you need exponential measures. That's not happening.
Health experts are calling on governments to pause the easing of restrictions or to even roll them back until the variants are under control. Will the vaccine and variants square off in a tight foot race? The fear is a third wave will soon take over with devastating consequences.
The younger you are, the tougher the battle is, because you have this vigorous immune system fighting a vigorous virus. And that plays out a long game with a lot of morbidity if we win.
Scott Frolick, City News, Edmonton.